Let me introduce myself. I am Chris Crickard, and I'm a paramedic with the Three Rivers Ambulance Authority, also known as TRA, in Fort Wayne, Indiana. I was asked to come here to the General Assembly to address the legislature because there is a bill coming up for a full vote shortly that I am passionate about. I was asked to offer my first-hand opinion and experience on the subject of the current opioid epidemic and how it impacts the emergency medical services. When I say emergency medical services, I am referring to police, fire, and the medics that respond on the ambulance. I was not chosen to speak because I am a phenomenal speaker. In fact, it is quite the opposite. Public speaking terrifies me. In spite of that fact, I agreed to come and enlighten you about the dangers of the opioid crisis, the need for allowing basic responders to carry and administer the reversal agent, otherwise known as Narcan, and how very important it is to vote yes when it comes time to vote on the Comprehensive Addiction and Recovery Act, otherwise known as CARA. I can say with complete confidence that no one starts out trying to be addicted to opiate medications or street drugs, such as heroin. No one wakes up and says, "Today looks like a good day to get addicted to drugs." It is usually a process that takes some time to develop. Unfortunately, it all too often ends badly. I agreed to come here to speak today for a few reasons. The most important reason is that I am tired. I'm tired of finding these young people dead, with a needle still in their arm. I'm tired of telling mothers, wives, and siblings that there is nothing more that I can do. I'm tired of responding to hotels over and over and finding the people not breathing, starting an IV, breathing for them, and giving them Narcan. It's not just happening in my little corner of Indiana. North America is in the midst of a massive opioid epidemic. Since 2013, deaths from drug overdose have surpassed death from motor vehicle accidents, making overdose the leading cause of preventable death in the United States of America. You might be wondering who this policy will impact. The executive director of the American Public Health Association, Jorge C. Benjamin, MD, wrote a letter to Senator Edward Markey of Massachusetts, thanking him for being a leader in representing the cause of the epidemic of prescription drug abuse and heroin abuse. In the letter, Dr. Benjamin stated that the Center for Disease Control and Prevention reported that in 2012, healthcare providers wrote 259 million prescriptions for opioid painkillers. That is enough for every adult in the USA to have a bottle. Almost 17,000 people died from an overdose of prescription painkillers. That is about 46 people every single day. Heroin overdoses have skyrocketed also. There are more than 8,200 deaths from heroin overdose in 2013. Dr. Benjamin noted that the strongest risk factor for heroin addiction is an addiction to prescription opioid painkillers. Dr. Benjamin recommends a comprehensive response to combat this complex epidemic. President Obama has asked for bipartisan support in voting for the CARA bill. With EMS, we have a powerful tool to help with overdose. It is called Narcan. We can give this medication in an IV or in the nostrils with a special administration device. We need to make this medication, the opioid blocker or reversal agent, available to more first responders. For example, in Fort Wayne, there are about 12 paramedic units on at any one time during the day or night. There are also over 19 fire stations and over 100 police officers on at any given time of the day. Currently, only the paramedic ambulances carry Narcan. We need to make this more accessible to the public. If all the police officers were trained to use the intranasal devices, and they were also available on the fire engines, we would assure more rapid deployment of the life-saving medication. If the level of certification required to give this medication was lowered to the first responder or basic EMT level, more lives could be saved. A few minutes could save a life. There would be training before this basic EMTs are allowed to use the medication, but the benefits far outweigh any risks. It is fairly easy to recognize the signs of an overdose: unresponsive, little or no breathing, and pinpoint pupils. It's literally that easy. This bill will provide money to train first responders, supply them with Narcan, and also train doctors on alternatives to opiates. It will also allow mid-levels, such as nurse practitioners and physician's assistants, to prescribe medication known as MAT, or medication-assisted treatment. According to Vashishta, Mittal, and Werb, MAT remains the clinical gold standard for treatment. This bill is estimated to cost $1 billion. It is part of what is necessary to help curb this crisis. There are 3 main medications referred to as MAT. Those are buprenorphine, methadone, and injectable naltrexone. These medications are found to have less associated deaths. There needs to be funding for treatment. There is also continued stigma about addiction treatment programs. That is currently, certainly, considered to be a significant barrier to care. Passing this bill will get Narcan out there, in the hands of more first responders, and save countless more lives. We also need prescription drug monitoring programs, PDMPs. These programs encourage data sharing to track prescriptions. Use of PDMPs in emergency rooms resulted in a significant reduction of opioid medications. We need to keep the doctors accountable. Doctors need to be educated on safely prescribing opiates and recognizing the signs that their patients may be beginning to have trouble with addiction. We need to educate the public on recognizing the dangers of drug abuse. In the past, we have worried about sharing dirty needles and spreading HIV. This is another area where sharing needles is common and risky behavior is common. Being addicted to opiates is bad. Being addicted to heroin is bad. Adding HIV infection to either of those is worse. We need to have a clean needle program to encourage less sharing of needles. I urge you to vote for the CARA bill. This is not a Republican or a Democrat thing. It's an addiction thing. People are dying, and we need to help them, and then treat them so they don't overdose again. I know that with your help and your vote, we will save lives. We can save families. We can salvage futures. Thank you for your time, and thank you for allowing me to speak on behalf of supporting the CARA bill. Thank you.